Yeah, we're setting up meeting for Facebook. 1 minute we'll be live. Okay. Live mode, yeah. Yeah.
Yes.
Hello. Welcome to this special program. With me today, I have the Director of Health Services. Can you guys hear me? Can you guys hear me? Tell me if you guys are hearing me. I know a lot of people are, we're here. Um, yes. Hello, can you guys hear me? I'm just gonna make sure people are hearing me properly. Can you guys hear me? Hello and welcome to this program. If you're watching, just let me know if you're hearing me properly so we can start the program. Tell me if you're hearing me. Okay, yes. Thank you. Thank you very much. Hello and welcome to this special program. I am broadcasting from home with the. I'm hearing noise from your end, Njai, but I think we're good now. Okay, we're good now. Um, yes, so I'm broadcasting from home because first I want to start with us, the measures we have taken as a company. When Corona started in March, what we did was we cut down drastically on our staff coming to the office because most of them don't have vehicles to come to work. So what we were doing is only the technical team, like 4 of them were coming. The rest of the team, they come in like once a week or twice a week. And then when we started seeing less cases, we started coming back in full force. Everyone started coming back in the office. And at some point I said to myself, actually, even with less staff in the office, we were doing good. We were doing well. So it seems like maybe, we should even cut down on our staffing. But again, it also taught us to change our way of work. We can be working from home. I'm sure Modou will tell you, for the first time in my entire life, I stayed home 14 days without going to the office because at some point I felt a little sick and I was worried. I said, I don't want to go to the office and like that, so I'll stay home. So I isolated myself and I stayed home for 14 days. But this has been what has been happening with our team. But so because of the surge in numbers right now, what we have done again is to cut down on our team. We will be working virtually now. The technical team will be in the office. All the presenters, the girls, they will be home. They will come in once or twice in the week. Like, for example, Kasa comes in one Monday, this person comes in Tuesday, just to make sure we don't have a lot of people coming in, especially those who take public transportation. We're looking at how we can even let those ones stay home and provide them the stuff that they need to be able to work. What we're also going to do starting this weekend, the brunch, we will have everyone stay home and even our guests and just do it virtually like this. Technology have changed and we can do all of this without going to the office. Yes, some of the team will definitely would go to the office, but we will make sure 60% of the staff stay at home. So for me personally, I'll be working most of the time from home. I will go to the office if I need to record something that I definitely need to be in the office, or if I need to edit, they'll bring me the machine here and I'll edit. We just have to make sure we're protecting ourselves. I am very concerned because I have my grandmother lives with me and she is above 80 years old and she has underlying conditions. I have closed my doors to everybody and I've told my people in my house, if you don't want to stay home, maybe you'll start looking for some other place to live. Because when it comes to my grandmother, I am so protective. And I think this should be the approach to everyone because these are scary times. For me, when it was announced that the Vice President of the Republic tested positive, that was it for me. That was it for me. I've heard all the world leaders, but this is our leaders now testing positive. This morning it was announced that the finance minister, the minister of agriculture, and the minister of petroleum have also tested positive. And we're getting a lot of reports, very concerning reports. I hope the Ministry of Finance, the Ministry of Health comes out and tells us every report that is every person that gets tested. Because in fact, if high profile people get tested, for them to come out and speak will add a lot of volume to our campaign in fighting this virus. Here at Kerr, I'm sure a lot of us, you have been following us. When this virus started in March, our entire programming changed. Every single week on our Kerr, we are either talking about the coronavirus online classes or we're talking about the coronavirus itself. We did that for almost 2 months. When the cases started going down, that was when we went back to our normal programming. So going forward, starting from today, we will do this. We will try to do a daily thing with Modou Njai or Dr. Bite, just to enlighten people. So Modou Njai, welcome to this program. Modou Njai, I think you are muted. Can you unmute yourself?
Thank you, Fatou, for inviting me. And then I'm happy to be part of Kerr today to discuss strategies we put in place as a ministry, and also to give people an update as to where we are with regards to COVID. And also, I'm happy that you have started since March, when we reported our first case. You were really scared, and you told me, Modou, you know what? I'm going to be in isolation. And since then, I know I've been following you, and since then, you have been in isolation. In fact, your isolation is more than 14 days. So we are talking about months and months of isolation, which is a good example and is a good practice. Thank you.
Actually, Modou, I am very, very scared. I am really, really scared. So I have been isolating in my bedroom. I don't even isolate in my living room. I don't come out of my bedroom, and my grandmother sometimes will just climb out and say, but I think I'm just I personally, what I did was to research, to do a lot of research. Every single day I watch CNN 24/7 to know everything about the disease. I go on YouTube. I just try to find out anything, because I think it's important for all of us to do that. So that has been my thing with this disease. Now I feel I am so empowered. I feel that I know a lot about this disease. So I am taking a lot of precautions. I want to share with my followers what I am doing on a daily routine. So I came in contact with Dr. Baji of Innovorex Global. And I think I was really scared. And we had a show with him, and he told us some of the, he said, now that there's no cure for this disease, but what you need to do is prepare your immune system, to be able to fight the disease, and also to help yourself stay stronger. And he recommended vitamin C, I think. He also recommended the immune system support, and I'm taking zinc. I'm drinking a lot of water. I am eating a lot of fruits, especially oranges. And I am also, I'm also taking, so apart from that, I have my cough syrup, I have my painkillers, I have my sore throat medication. In case I feel headache, right? I take my painkillers. If I feel a little thing in my chest, I take my cough syrup. If I feel that there's something that I'm feeling uncomfortable with, I take that medication. Cure whatever is paining you at that instant. Take that treatment for that particular thing, and then also take your immune support to support your immune system. That's what I have done for myself. That's what I have done for my grandmother. That's what I've done for my dad, because I think they are much older. And also I've recommended people that I live in my house, I buy vitamins and make sure everybody takes it. I make sure everybody takes their vitamins every day, because if one person gets the virus in the house, everybody takes it. So for those of us, some people cannot afford all of these vitamins. So I've always said, take a lot of oranges. We have a lot of oranges across. Make sure you take 1 orange a day. I don't know. These are just some of the things people say might be good. So I think I just want to share this with my followers. At this point, I feel like it should be everyone for yourself, because we are overwhelmed. But before I get into that, I want you to give us a situation. What is the current situation of coronavirus in the Gambia, Mr. Njai?
To inform the followers that the situation of the country currently is not encouraging, because we have recorded 498 confirmed cases of COVID-19. And this is really showing an increase in the number of COVID-19. And we have 414 active cases, 68 recoveries, and then 9 deaths. And this is we have about 529 people in quarantine. I think basically we also want to inform people that out of the total number of people who tested, 6,011 people came forward to be tested. Out of that, 498 became positive, and 5,234 are negative. With regards to contact tracing of people, following them up, we target to reach out to 1,731 people. That's our target. But we are able to reach out to 1,681 people. Meaning we still have a gap of a certain number of people to see. So we are appealing to anyone on this platform to appeal to their family members. If they have people who have reported symptoms to us, or they are already under our review, we want them to report them to us through our 1025 with their details, so that we can be able to get them to on time. This is really a concern for us at this point in time.
Monday, I want to come in there, because I think at this point, we should all be realistic. There are some concerns that you guys are overwhelmed. And I personally know some cases that you guys are overwhelmed, and there are issues with even the 1025. But before we get there, I want to say this. For those of you who are saying, I don't have a mask, I am not even in my living room. I am in my bedroom. And I think the health expert knows that I can do this, because I'm in my bedroom. I am not in contact with anybody. and no one is coming here. Like only my grandmother is downstairs and one person, and they are not coming here. So that is why I'm not in mask. So for those of you who
no,
are
it's
saying,
okay.
Yes, but
That one is okay.
Yeah, but Modou, what I wanted to say is this. I think at this point, I think it's good to be realistic. You guys are overwhelmed. I know of people who are calling the 1025 numbers and people are not picking. I know of people who have shown signs of the virus, and we have contacted the ministry. I was personally involved up to today. 2 days ago, they have not been picked. We had to isolate them. And I know because all of this is because of logistics, or even you don't have the space. I think it will be good for us to be realistic and tell people why people need to take precautions. If the ministry is not able to pick them, what they need to do is important, because as a country, we know the resources are scarce. We know we don't even have the facilities. Some of the hotels, all the hotels that you guys have are fully booked. So would it not be realistic to tell people what they need to do if they contact the ministry and they are not able to pick them? What do they need to do?
Actually, Fatou, you are very right. Let's start with the 1025.
Yeah.
We know there were challenges over the weekend. This was as a result of the technical issues we had at the call center. Okay. And people, we want to apologize for that. What happened is like the people who are operating at the 1025 center, or the call center, a couple of those people got the virus.
Yeah.
And then the remaining were scared to go into the call center. So we advised them to go with the phones, the main phones, to them, so that if anybody who calls the main line, they'll be able to reach out to the other lines.
Yeah.
So we realized that few of the four main lines, about two of them have some issues.
Yeah.
They have some technical issues, and we had to contact the GSM companies so that they can able, because they've taken the phone away from the call center. And that was what has created that problem. But when we detected it, we didn't know about the problem. But when it was reported to us, we were able to find out until we came to the bottom of the problem. Then we were able to sort out the issue. And as I speak to you now, if you call it 1025, you will get it. In fact, this morning I got a message that a couple of people were traveling with a boat through Bakau, and they were apprehended there. And then this was information was able to reach out to us through 1025, and the immigration were able to get them. So the 1025 currently we have some issues over the weekend, and then we are able to sort it out. And we are very sorry for any inconvenience that we may have caused to the public. With regards to being overwhelmed, I know that there are issues like with regards to testing. Many people tested, and then they're waiting for their results.
Yeah.
It took about 4, 5, 6, 7 days. This has been a challenge. We have to know. We noted it. Today we discussed it at the meeting at our early morning coordination meeting, which we do on a daily basis. And we were able to strategize that we need to clear the backlog of the tests that are the samples that have been collected, so that the analysis can be done and people get their results. We're also trying to strategize the issue of testing in the like MRC. We know that we will take our samples now to MRC in Mabase and then Keneva. So that's also another way of decongesting the samples we have currently compiled at the National Public Health Laboratories. Notwithstanding, sample collection is still ongoing, but because we had we did the mass testing, and this mass testing resulted in a huge number of samples to analyze. And then sadly enough, most of our key people at the National Public Health Laboratory, and as well as that of MRC, also contracted the virus. So our key people are already admitted at the treatment center, and we had a few people on the ground who are supposed to do the sample collection and then do the analysis and then giving us the results. We also have issues with contact tracing. Like we know that as we have more and more calls coming to the call center, the demand has also increased in terms of calls, and then the demand for us to respond to them. So when they call and they expect that we give them feedback, and then the feedback sometimes the call center is supposed to connect the call to another level, another thematic area. It could be rapid response, it could be the contact tracing, it has to do with an issue with case management, they refer to the case management. If it is logistic, they refer to the logistic. But the response rate is always very slow. So this is why we are having these complaints and challenges from the public. But we were able to sort out all those things. And now today, we agreed as a team that the rapid response should be proactive, and so that whenever they get calls from the call center, they need to act. Just like today, the call that has to do with the people the people who travel by boat, the Bakau, when it was reported, it was the message was sent to the Deputy Permanent Secretary Finance and Admin, who forwarded to the security team through their platform, and the securities acted and they apprehended them, and currently they are in the hands of the security. So meaning that we are also learning. As you know, the disease is new, and then whatever strategy we put in place, we implement them, and we come back again to review, and then strategize. I know you will be also hearing about complaints from people saying that they have been discharged from quarantine, and they've been asked to go home before prayers, and they have to go home. Yes, we are trying to change our policy for quarantine, and then meaning that when people are taken under quarantine, they are tested, and if they are negative, then we will allow them to go home, and then they still to continue to practice, and then try to observe the precautionary measures whilst they are at home. Until such a time that if they possess any signs and symptoms, they need to report to the nearest district surveillance officers. We also observe that some people are saying that some people are on treatment, and then they have to be discharged and go home. Yes, people with asymptomatic, and they don't show any signs and symptoms, and then they got the virus. They'll be treated, given the treatment, and they'll be allowed to go home, and they'll continue on self-isolation. We are working on all this documentation, and when we are ready with the documents, we'll coming back to the public to inform them about our policy in quarantine, our policy also in the treatment center, and also our policies with regards to the testing. And now every day people are calling, they want to know where they want to go, where they will be tested. We are yet to finalize a certain strategic location in the country where we're going to designate them as testing centers, or maybe sample collection sites. So this has been a challenge for us, but I'm sure today with the laboratory directorate was able to come up with some suggestions, and then I'm sure by next week we'll be able to come out to the public and tell them where and which places are they supposed to go for them to do the sample, for the samples to be collected, and then it will be tested. All the testings are going to be done at the National Public Health Laboratory and as well as the MRC Gambia. This is an update for and also with regards to the congestion of dead bodies at the mortuaries at EFSTH and then Canifing. Now we are also coming up with a strategy so that the Red Cross volunteers will be trained how to collect swab from dead bodies, and when they collect swab, then they will now allow the various modalities to be done, and then these burials will be done in a dignified way. But we don't want to, why we are doing this, we don't want to accumulate dead bodies to be at the mortuary in both Canifing and EFSTH. So that when bodies are taken there now, the volunteers are there, they'll be trained. In fact, some of them have been trained how to collect the samples from dead bodies. And then when they have dead bodies now, it's just a matter of going there, collect the swab, and then once it has been on process for analysis, the burials will be done and in a dignified way, and it will be under supervision. That's also another strategy we are coming up with at this point in time. So right now we've also decongested Canifing and then EFSTH with regards to dead body accumulation that was done over the weekend. But the public also need to understand that during the weekend, we went into the Eid celebration. And then most of the operations, they did not stop, but some areas there are some gaps in some because some of the key people are not around. They have to witness the feast. People like myself, I didn't enjoy my feast, and the next day because I had to be on TV to give an update. So, and I think others also have been working very hard, but some also people have to definitely visit their families. And if there are some certain gaps or there are challenges, or maybe we may have caused certain inconveniences to the public, to families and family members and friends, I must have to apologize on behalf of the Minister of Health. That is not our intention, but our intention is to make sure that we provide affordable and acceptable healthcare services to everyone without causing any hindrance to them. That is not our objective, but we also want to make sure that we will continue to provide basic healthcare services for you. We will also continue to provide the best of isolation and quarantine services, and as well as treatment services for those who are already affected with COVID-19. For now, Fatou, I want to throw the. Also, I want to make some clarification with a video that was in circulation, Fatou, with regards to claims being made to say that people are giving monies at the airport and also at the quarantine center for them to be allowed to go home. I want to make a clarification on this. This is the reality on the ground. You may have traveled with somebody on the same flight going to the Gambia, but when you land at the airport, you may not end up seeing that person anymore. But that doesn't mean that the person has given something to somebody for the person to go home. This is because we are all taken to different locations in different hotels in the Gambia, especially in the Greater Banjul area. But some of them also, they will see them being taken out of the queue. These are either diplomats or the UN staff or MRC staff. The UN already have a quarantine center for the UN staff. Any UN staff that comes, they are taken from the queue and they continue and they are taken to their UN quarantine center. For diplomats, we got a communication from the Minister of Foreign Affairs that are there to be treated with respect and dignity. And as a result of that, when they come, we will also allow them to go in for self-isolation. And some of these diplomats are also taken from the queue, and then they're also going to, what we do, we follow them on a daily basis. And some of them will talk to you later. I'm sure they will tell you the scenario. And then with regards to MRC staff, those people who, when they get their people on the queue, they take them to the MRC isolation quarantine center, and which is the main camp in MRC Fajara. And when they go to the quarantine center, you may not see them again. But sometimes you see them moving out people during the day and taking them to the, for example, if somebody comes with a medical condition and then the person needs help, obviously you need to put that person in. Transporting person to the nearest health facility. Somebody can come with diabetes or hypertension or can have another chronic condition, and they complain to the team on the quarantine center. These people are normally allowed to go to the hospital, get their treatment or advice, and they come back. Sometimes you will also give a room to somebody who might be physically challenged. And this particular individual, you give them the toilet that they cannot use, they complain, you have to move them to another level where they can be able to use that facility. So perhaps when you see them moving that particular individual, you think the person give them something. With regards to somebody is taken to another particular room, and the condition is not good. So the person can also say, okay, because we want to respect them. We want to give them their right. It's their right to have access to safe and conducive environment whilst they're on quarantine. So in doing so, whatever complaint they give us, we make sure that we sort them out. So perhaps I want to make this clarification. Yes, Fatou.
Can I come in there? Because you have touched on some very important issues that I want to. I have spoken to. I have so many colleagues who are at the treatment center, and I have spoken to some of them, and some will tell you that people have been visiting the quarantine centers, the treatment centers, bringing basic necessities and food, because the food that is they're being served, people, they're not happy with it. That I don't have a problem with, because you know, you cannot be at a treatment center and have all the necessities that you require, you want, because it's expensive. But family members are allowed to come into the treatment center. There is one security. One person told me their first day there was no even security at the hotel. Family members were coming in at the treatment center and bringing food to their people and sitting with them, chatting with them. And these people are being treated. And so, number one, people are saying that the security at the treatment centers is not strengthened, it's not good, and because people are coming in. What's your response to that?
Fatou, if that happens, that is a security lapse, and maybe it's also a lapse in our team. Not that, as we know, we're in this situation, and then let us not expect everything to be perfect. And then these are things we're also learning along the way. With regards to the food, I know that some of our colleagues even complain to me who are in that they have been given one single type of food on a daily basis for that number of days. And then we had to take it up with the operations, our operation team leader. And then I was able to personally call him, and I told him, well, if you look at the treatment center, these are the complaints coming from some people. Because when I got that information, I had to communicate to him, and thank God, and some of those actions have been taken. So we are also happy that this information is also coming to us, and we will find out, we normally investigate, and we find out and we respond. And where we need to act, we act. Where we need to, caution staff, we caution them. I think this is something that we don't compromise. And the minister doesn't compromise with such things. So therefore, if that happens, it's a lapse on our side, and we must apologize for that. But that is it's not normally the situation in the quarantine center or the treatment center. It's not normal. But if it happens, it is a lapse on our side, and then we just move on from there and moving on forward. And then we want this type of complaint when they come. As I got the other complaint, when we get it, we also try to channel it through the appropriate authorities. Like what the video that was done, if the guy who did the video contacted us, we would have given the person all the necessary information that is involved. So that is, but I'm happy that you are bringing this thing forward. And these are comments coming from friends and family members. And we trusted you, and we also trust your source. So what we want to say is we will not have to apologize in this area, but in a quarantine setup, we have guidelines, and the guidelines must be followed. No matter what, it must be followed. In a treatment center, there are guidelines that food cannot be entered in, and then people also have to make sure they comply with whatever condition they have there. And we try to make as much as possible to make the environment very conducive for each and everyone there, knowing that it is very expensive to keep people there, but the ministry is still going ahead to make sure that people are satisfied. But it's not easy to satisfy human beings. Whatever you are doing, somebody is also seeing it negatively on another angle. But be rest assured, every day we are looking at this everyday meeting we are doing is also helping us to at least to move on and try to scale up our strategies, and trying to also, wherever we think we are not doing well, we also improve on those areas. So that's what I want to add on to that particular area.
Mr. Njai, so one thing also that we have had issues with is resources. We know coronavirus is across the world, and even the donor partners who are supporting us, they're struggling because they have to help everybody. And with the mega resources we have in the country, a lot of us believe it should be centered on our local transfers and others. Like I said, with the treatment center, I have had experiences of people having symptoms and signs, even people testing positive, and the Ministry of Health were not able to pick them for 2 days. I know of people who have had tested positive, and the ministry was not able to pick them for 2 days. So one of the times I had called personally, and they will say, we're having issues with the ambulance, because I know that a lot of health officials have also tested positive, and the ambulance drivers, it's a lot of struggle. And also the other constraint that you guys had was the facility. You don't have a lot of space to take people. And I believe one of the reasons why you are not having a lot of space is because of the flights that are coming into the country. I have done my own internal investigations. And if a flight is carrying 150 people, for example, every single flight that comes into this country, the Gambia government, taxpayers, are paying close to 10 million for flights for quarantining those people. I came to this number through paying a hotel accommodation because I saw the list of the amounts you guys pay at the hotels. You know, it was public at one point. If you multiply how much every single person pays a day for 15 days, they are tested twice when they're in quarantine. They get meal every day. They get logistics, taking them from the airport, coming in, all the hand sanitizers, all the basic things that are provided for them. It's close to $10 million every single flight. I stand to be corrected, but during my own internal investigations, this is what I came to check, the numbers that I came to it. Why are we spending that much in bringing people into the country and quarantining them? Can't we use that resource to work on the local transfers, number one? If you go to Senegal, I have so many people that are coming in through Senegal. What they have is a testing site at the airport. When you get in, if you have not got your, like, how do you call it, a certificate, 72-hour certificate, if you have the certificate from the country that you're coming in, they let you in. If you don't have the certificate, they will test you. You wait for your results. If you test positive, they'll tell you to go and isolate yourself. If you test negative, they'll let you go. But why are we not doing that? So many countries are doing that. America is not even quarantining anybody. UK is not doing it. Why is the Gambia taking it on up itself to quarantine everybody with the mega resources that we have? If we're not able to accommodate them, why are we letting people come in? Because right now, as we speak, we have had health officials complaining about their scale. I'm sure there was a time there was an issue like that, getting paid their allowances and others. Why, instead of using that money to quarantine every week a flight of above 100 people, why do we have to do that when we can use that resources to use it for local transfer?
Thank you very much, Fatou. That was a very good question. I want to start with the challenges with regards to collecting people who are positive, and then for them to spend more days in wherever they are. I want to make it clear, yes, we also received several calls through the 1025 that so is positive, tested positive, and is at home waiting. What happens is, like, when the information comes to us, we pass this information to the next level, the rapid response. And the rapid response have some other branches. Now it has to do with positive cases now. That is transferred to the Gambia Red Cross Society volunteers. So what they do, they pick people in different strategic locations. So there was a day even, I think they were picking people up to around 4 a.m. From morning, the same team, they were collecting people, because what happened, they have challenges with addresses. Some will tell them, I live in Sinchu, and then they will not tell them where in Sinchu. And then when they call, for example, somebody call in Wellingara, and they will say, okay, we are in Sinchu, but from there we are coming to Wellingara. But by the time they trace this particular individual as Sinchu, it will take them more than 2-3 hours. So the person who is also waiting at Wellingara will also be impatient with them. So this is what we have been receiving. So we want people now, whenever they are giving them our team's addresses, let them give them complete and accurate addresses. If possible, your telephone number. If sometimes they'll call them, and then when they start going there, when they start calling, the numbers will be off. Either the batteries are down, or something else, or the network issue. So they find it that they keep on standing there, waiting to get to that particular individual, especially when they're in an area that the person lives. So this is an issue, but I'm sure when we cause any other, difficulty or challenge to people who have been tested positive and they stay longer in waiting for a team to collect them, it is not something intentional, but this is something that has to do with either our side or also the side of the people they are collecting. I mentioned two scenarios. The scenario of the case that where people don't give proper and accurate address, and sometimes also the communication between our rapid response team and the Red Cross. Sometimes there is that gap, communication gap. But these meetings are very helpful today. We are able to map out all those challenges because we have learned a lot over the weekend, and we are going to improve on them. Inshallah, those things are because today.
I'm not going to let you go. I'm not going to. Let me.
I'm coming.
Before you
no, let me complete. Right now, today, the logistic team have also been assigned to provide extra vehicles for the burial teams. They've been also assigned to give extra vehicles to the rapid response team, and they've also been assigned to give extra vehicle and to the laboratory. And then the ambulances that we are supposed to use for picking people who are positive, they are going to be operational starting from, and some of them started over the weekend, an additional number of ambulances that are new, because these ambulances are fully electronic and they are complicated. So the driver started training, and then after the training, they will be given the ambulance and they'll be scattered around, so that wherever there is a positive case, this ambulance and the Red Cross team plus our rapid response team will just go and pick these individuals. This is what I want to add to this other part. Then I go to the spacing. I don't know whether but I know you are smiling, but I'm not defending, but I'm just saying exactly what is happening on the ground. With regards to the spacing.
Can I come in? Can I come in?
Yes, you can come in.
Before you go to the spacing, I still want to come. I know, because I have spoken to many of your colleagues about this, because I have particular cases that people that I know who have symptoms and they wanted to be tested, and we were worried about their condition. We isolated them but up to today, for 2 days, the ministry keep telling us we are coming for them, we're coming for them, we're coming, and they have not come. And they were not even able to provide any support. Njai, those kind of things. For me, it's understandable if you are overwhelmed, because I was told that even the ambulance drivers were infected, and it was difficult. Some people get scared. They were scared to even drive the vehicles. Those were some of the logistics issues, which I understand, and every person will understand. But also, would it not be ideal to have a team when you have situations like this and people who have conditions, to be able to advise them and advise their families as to what they can get them, how they can help them to get stable before help comes? I think it will be important to set up something like that, because I know ministry cannot have you don't have all the resources to be able to take everybody in. But in case somebody have a situation and they are going through some breathing issues, and there are certain things that you can set up a team, people, professionals who will be able to advise them. Can you order this medication? Can you take this? Can you take this before help comes? But if we don't have, in the absence of that, what happens to those patients if they're not able to provide services from other private health personnel? What happens to those people, Mr. Njai?
To just be assured, we are working on a guideline for self-isolation or home isolation. And also we are working on guidelines with regards to quarantine. And today, all those documents are going to finalize. And when they are finalized, we will come back and then inform the public about what those guidelines or the SOPs are about. And then we are also planning to translate these guidelines and SOPs into local languages for wider distribution to the public. So that when you know that you possess the symptoms, you are a suspect, how you can stay at home to manage your condition, and also if you are positive, before they come for you, what should you do? So all those documents are already available. We are reviewing them. As I said, we stretched ourselves over the weekend. A lot of work has been done, and because we were thin on the ground, but nonetheless we were able to coordinate our efforts, and then we are able to be rest assured. This is also a learning thing for us. Like most people among us did not also experience pandemic like this. Although few people among us also experienced an epidemic situation. So we are also using those combined strategies, and what we have learned in the previous interventions, what we need to put together. So definitely, whatever lapses that has happened is a learning point for us, and we're going to pick it up from there and improve on it. But the beauty of the whole thing is we're a small, underdeveloped country, but other countries are bigger than us. They still have challenges with regards to collecting dead bodies, collecting positive people, and even transporting them. But without bigger resources, we are able to, at least reach out to them. Or we call them to tell them, yes, we are here, we will come, and we keep on constantly communicating with them. And we also arrange to pick them up, and we bring them to our treatment center and our quarantine center, which other countries are not doing, and they are not doing it for their citizens. I think we should be commended for that as a ministry and as a country and as a government. So I think with that area, with all what the challenges, but we are also doing our best. But we also want the same support from the community, because we cannot effectively address community issues without the involvement of the community. So that's why at some point we had engaged the district authorities. These are the chiefs across the country. We will also hope that they will go and talk to the alcalis, who will also go and talk to the household heads. The whole idea is to get the information widely spread so that everyone will know that COVID is real and we need to protect ourselves by also observing the precautionary measures. We rest assured, whatever challenges we have gone through, those things are past. And for the testing, we've also scaled up. Testing is now been done at NPHL in Kotu, National Public Health Laboratories, MRC Fajara, MRC Keneva, and MRC Basse. So that we've also scaled up. Now that people may have difficulties in bringing samples from Basse or Bansang or maybe Farafenya or Soba, all those things are now thing of the past. Now the analysis will be done in those areas. We're also working on a strategy because we know KMC is a big area. We're working on a strategy to be able to do testing in a strategic location. And we're going to do a map of the areas we can do sample collection, where all the analysis will be done, and either at MRC Fajara or a National Public Health Laboratory. Because normally the samples are divided. When they are all bringing together, then they are divided. Half goes to MRC, and the other half goes to the National Public Health Laboratory. We want to also appeal to the public to continue praying for our giants, our heroes, who are the National Public Health Laboratory, who are also in the various thematic areas of this communication, logistics, case management, psychosocial support, and other thematic areas for them to recover, so that we can also be able to continue the fight. Because without their presence, we're still feeling and thinking about them, no matter what speed we have, and then the stamina we have. When we think of our people, our colleagues, our senior colleagues who are currently in quarantine, we feel a bit the energies are always a bit down. But when they are with us, we can do more together. But we want to ask for the prayers from the general public, so that these people can come back home, go to their families, and also come and join us in the fight against COVID in this country. That's what I want to appeal for now. And then the other one you talk about, I forgot the other point, Fatou, you mentioned. I know there are a lot of issues that you came.
Let me come in. It was about the flights that are coming in, specifically.
Yes, the
commercial flight, which is coming in.
No, let me address. I know, Fatou.
Yeah.
There was a day you must have heard that the Minister of Health, in collaboration with the GCAA, did not give permission for one of the flights from one of the European in Spain to disembark about 47 passengers on board. And when they were coming, they came with the pretext that they're bringing 4 dead bodies, and they're coming to pick other people, but not knowing that they also have passengers on board that we are supposed to disembark. And then the people were not allowed to disembark, and they were sitting in the flight until such time that we got an authentic document from the company to say that the airline will be responsible for the quarantine of those people. The airline will foot the bill of all those people who are on that flight. Until we got that documentation agreement, then the people were able to disembark and then went to the hotel straight. And the airline took care of the transportation from the airport to the hotels and also their hotel bills. We know quarantine is expensive. It's not sustainable.
Can I come in?
No, wait.
No. Let me come in.
Okay, I agree. I wait for you. Okay.
Let me come in. You are talking about this particular flight. I'm talking about, let me just be clear, SN Brussels come in every week. And the government, who is footing the bill for those passengers? Let me just put that out.
Okay, right. The government is putting the bill of those people, but we are coming up with a communique that anyone who comes into the Gambia, fly into the Gambia, and it's taken to quarantine, you will be responsible for your own bills. This communique will come as we are trying to finalize that, and then the team will work on it, and then when we are ready, we'll come back. I'm sure you might be the first person to make that announcement because I know you like to give breaking news. So we will give you that. We will definitely make sure that those things are available to you, and the information will also be communicated widely, so that anyone who is traveling into the Gambia will know that they'll be responsible for their own quarantine facilities. Fatou, we are also changing our strategy.
So let me just clarify here. So what you are telling me is currently you are working on a communique to that everybody who comes into the country, you will be responsible for your own quarantine. But before this,
we are making life easy.
Let me finish. But before this, the Gambia taxpayers were paying for all quarantine people.
I agree with you. I said yes.
Okay, thank you. Go ahead.
And I said, quarantine is not sustainable, and it's very expensive, but very effective. Because what happened is, most of our cases, we detected them through quarantine.
But how effective can the quarantine be if people?
No, I'm coming.
Are coming in contact with family members. How effective is that?
No, Fatou, let me come. At the beginning of our quarantine strategies, we were able to detect all the cases. 80% of the cases at that time were detected through quarantine. Okay. So if people are not put on quarantine at that point in time, we will not be able to detect them. They will go home like that.
Okay.
That would have been more disastrous. So I think for us, we have to be commended. The ministry need to be commended for coming up with a strategy for the quarantine people. And we have been a model in the African region in terms of quarantine. So I think that has to be acknowledged also. But notwithstanding also, it is expensive, it is not sustainable. That one we are aware of. That is why, instead of now, when we put people in quarantine, they test you upon arrival, or upon starting the quarantine. If you are negative, then they allow you to complete the mandatory quarantine of 14 days. And then at the end of the 14 days, they test you again. If you are negative, they allow you to go home with supervision. If you are positive, they take you to a treatment center. But now that we are changing that strategy now, what we are doing, what we'll be doing so far, we've not finalized that yet, but I'm sure today it was discussed in the meeting and agreement has been done. We're going to put people on, wait.
My question, Mr. Njai, my question is, why is SN Brussels allowed to come in weekly?
Okay. Now I didn't get your point.
We have Royal Air Morocco. We have Turkish Airways. We had all these airlines that were coming into the country. But why is SN Brussels the only one allowed to bring weekly?
I know, Fatou, if you were in the UK.
I don't want them to be mad.
If you were in the UK at that point, now I'm just giving an example.
I don't want to be
and you want to come to Gambia. The only flight you can use is SN Brussels. And we will not tell any Gambian that you are not allowed to come to the Gambia. Every Gambian has the right to come to their country at any time. So if they decide to come, we will allow them to come. And then if they decide to book with SN Brussels, because we all know, you and I know, if you're traveling between these European countries, SN Brussels will be the main airline that can connect you from America, from the UK, down to Brussels and Brussels to Banjul. That one I know, you know about that. With regards to why are they coming, I will not be able to give you that answer, but what I can give you is that people out there are putting pressure on government that they want to come home, they need to come back. And then when they put pressure on the government cannot tell them that you cannot come. They are citizens. They have the right to come to Gambia. They have the right to come to their country. So therefore, that is why they've been allowed to come. And when they book with SM Brussels, and then obviously they'll come with SM Brussels. If they book with another airline, Turkish airline, they'll come with Turkish airline. So this is it. So I don't know what question, what answer are you looking for? But basically, this is where I can stop for now. But I also started something about the quarantine. We're working on a very simple strategy now. So anybody who comes in quarantine, and then you are tested, if you are negative, we'll allow you to go home. Within 2-3 days, you'll be allowed to go home. We're also debating on that, but I'm sure by the end of this week, we're going to finalize that. But this is something that is in the discussion. But that's also going to make life easy for everybody. So that when you are at home, then we'll also continue with this community education. Community centers that will start. And as I tell you, the Medical Student Association have started the aggressive community sensitization. The youths are going to start by this week. We already have a PA system. About 1,000 will be donated by UNICEF. And we're going to recruit about 100 youths who are going to be PlayStation in markets, in garages and other places, and then telling people, reminding them of people to be putting on face masks, to observe physical distancing, and as well as to continue hand washing. This campaign also will start. We're also going to mount PA system on vehicles, and then they'll be going around. I'm sure they'll all come up to the area and you will call me to tell me that your people have just passed. So we want to just tell people while they are self-isolation, what they should be doing, and then what support those family members also need. Because we have also realized if somebody is positive, or maybe somebody is just been taken to quarantine, and when they come back home, there is that still stigma and discrimination against those people. So we also want to put that in part of our campaign. So rest assured, we want to make life easy. The ministry is very considerate and want to make life easy for every individual who comes into either quarantine or the treatment center or in our isolation facilities. We want to provide them with the right dignity and with the right respect, and also we make sure that they have the right to shelter, food, accommodation, or whatever thing they need to get. This is also the responsibility of the government, but it's expensive. I agree with you. I know that's what you want to say. That's why we are coming up with strategies so that government can be able to save monies in other areas in terms of spending on quarantine. But quarantine is effective because we have registered so many of our cases through quarantine, especially at the beginning of the quarantine process. And other countries have come, in fact, learned from us. During the ministerial meeting, Wahoo ministerial meeting, our minister reported our strategy at the beginning. And most ministers also in other countries were able to adopt our strategy with regards to quarantine. So I think we are a small country, but we are doing things that other countries are adopting from us. So we have to thank our honorable minister and the team for that, and you yourself for making people to know what we are doing in the country.
Thank you. But another issue you just highlighted is the strategies you're working on now when it comes to sensitization. I believe it's rather late, and let me give you reasons why I believe it's late. I have worked with you guys, the Ministry of Health and the Ministry of Education, and I have said this openly, in fact, to you. What is the ministry doing with the sensitization budget? All I see is billboards around the country. The Ministry of Education, when they wanted to do the online classes, they worked with all the media houses. And of course, even the people in Kiangdumbuto know about this online classes. Whereas they will tell you, maybe I don't have a TV, or maybe we don't have a radio, but what has the Ministry of Health done apart from regular press briefing? We do know that you had made regular press briefing, but these press briefings we are live streamed either on Kerr, Fatou, iAfrica, Gambia Talent, and also on TVs. This was what was happening, and also the newspapers, the local people. How often were you on radio? I went to Kiang one time, and I remember me and Lavin Cham, we went to Kiang, and it was a funeral, and people were packed. And when they shake hands and you tell them, oh, Corona, they tell you, Allah kumbu sasa. People don't seem to understand because there were not so much information out there. You don't think it's late? Why did it take you guys long? You guys had so much money to spend. Why did it take so long to sensitize the population? All the media houses were sensitizing on their own without any support. They did it for country without any money from the Ministry of Health. Why is that so? That I can say because I'm a media owner. Why is that so?
Okay, thank you, Fatou. I think I would just want to tell you, with or without resources, our risk communication team were out there using all the community radio stations in the country since January to now. And then we have free airtime there. And currently also we are engaging influential leaders in all the community radio station sessions we have. That's also ongoing. We also have been having engagement with the chiefs, the alcaldes and the district authorities. That's also ongoing. And we also have our weekly clinics conducted by health facilities. We're also using that to sensitize the public. We also had plans as a RCCE committee to able to at least pay airtime to various private and then private TV and radio stations. The proposal have been written. I have it here, but this proposal unfortunately was not been approved by the Finance and Procurement Committee because they felt that, well, the reasons best known to them, which I cannot justify here. We also propose to at least provide the support to artists, and that proposal was also done, costed and approved, and currently the ministry is working with the GPPA to follow the procurement procedures to support this the artists that were able to produce songs and videos with regards to COVID. And we also did a series of community bantabas, but as you know, we are trying to discourage committee meetings and committee bantabas because that will also attract crowd. And when we come up with policies and guidelines and regulations, we should not be forced ministry to at least to break those rules. So that's why we are very careful. What we do now is we mainly do like one-to-one sessions, radio programs, and we make it more interactive and participatory. And our plan also to build the capacities of TV stations and radio stations that have been very supportive to us since day one. But we are still pushing, although our requests have been not been approved, but we are still pushing hard to get our requests approved so that definitely we must have to thank all the private radio stations and TV stations, especially your station. I think you are one of the first stations that invited me, and followed by my trip there with Dr. Bite and others. And I think it was something that we have to thank you for coming out at a time when you are mostly needed. So we will continue in that regard. But we also have a series of caravans. Well before the ban on this public gathering, we did series of caravans. And then what we also did now, during the press briefing we were doing in English, we also try to do them in local language for better public understanding. Although we have some challenges, there was a video, a drama sketch that was going around, and then by one of the institutions that came was able to produce that. And in that video, somebody was saying, Allah Kombokuram, or the disease from the urban area. Yep. So you don't hear it now, because I had to intervene and then ask that institution to stop airing that particular video, because it's really causing a lot of confusion in the community, and that has been stopped now, and that's why you are not hearing that video anymore. Yeah. That drama is no longer being aired anymore, and the radio station and the TV station where it has been aired also, we're also giving warning not to air that one, and then thank God it has been implemented. So we have some challenges. Once we are working, we also been having series of what do you call it, fake news, and then rumors here and there, and sometimes they distract us. When we want to move at one end, there's one other rumor or something, we have to distract back and try to solve that particular problem. So until Secretary we were stable, it has been a challenge for us as a committee, as a risk communication committee. But when we were stable, now that we are able to strategize, re-strategize our intervention. But the rest also, community activities have been ongoing, and then we also did the engagement of borderland communities, where community leaders, village development committees, opinion leaders in those villages along the borderline were also engaged. So a total of 135 to 136 communities along the borders of, I would say, from LRR around coming back to North Bank, Bara. I think that those communities have been engaged. And currently, with support from IOM, they also engage in regional authorities to reach out to other communities that we are not reached. And we also made a recommendation that the villages that are also close to borderline communities that are within the Gambia must also be engaged. We are also discussing with the Honorable Minister, who have also approved our proposal for us to be able to do what we call the cross-border interventions. The cross-border interventions are also very helpful, so that when we intervene in Gambia, we can also move to Senegal, maybe 1 or 2 kilometers, which are the radius of the community we are able to meet, and we start this collaboration with the authorities in Gambia and Senegal to work together as we did with the malaria intervention. So these are things that we are working on, and I'm sure because of the restrictions of movement, some of those things kind of like at that point in time, when there was serious lockdown and then border closure, it will be difficult for authorities in Gambia to move to Senegal to do some intervention, because when they come back, they'll be quarantined. And that was the challenge for us. But now that we are moving on towards home isolation, home quarantine, for example, and also maybe the border closures also will be lifted, maybe borders will be open, then we can now start to strategize our intervention. I'm sure whether we like it or not, ECOWAS is coming up with a communique to open all borders. So I don't know what we're going to do, but it's going to happen. I don't know when it's going to be in effect, but it's going to happen. So if land, sea, and land and air space will all be open for people to start moving. Yeah.
So during one of the minister's engagements, I did hear him say our peak will be around July, August, if I'm not mistaken. He said our peak will be around July, August. And obviously every country have a peak. And the projections are right. Our peak has come around that time. Knowing that our peak will be around that time, why did we loosen up? And also when it comes to enforcement, basically there is no enforcement in the country. I was part of those who advocated to open our economy. And my reasoning was, we have the mosque open. We have all the churches open. The markets are all open. Everything else is open, and you are telling businesses to close. Businesses who don't even have maybe 20 people in their premises. You have thousands in the market. You have hundreds in mosques and churches. Why is this a political move? Even during the Tobaski break, when the minister came out with a communique saying he's imposing SOE for 90 days, but they still excluded the mosque and the churches. Is it because of the backlash that is coming from these religious leaders? Why are we doing that? That's why our enforcement is not even effective. How effective is the enforcement? Is it
the enforcement, I would say, without some challenges with regards to enforcement. Fatou, let's be very realistic.
Yeah.
In this country, you want to implement certain things, people see it otherwise.
Yeah.
And then I think that has been an issue, but we didn't get the support from the general public. If there was support from the general public, it is the people themselves who will be on the watch out, who will be controlling other people within their surrounding, to ensure that they put on the mask, to ensure that there is no public gathering, and to ensure that mosques and churches are all, the precautionary measures are all being observed. But the people have to take the responsibility of health in their own hands. If that did not happen, government alone cannot do it. Government can put up strategies, regulations, and policies, but it is left to the people now to implement those strategies. So key among them, people coming out themselves to say, we are going to do this in our community. People need to come out and with some bylaws. In a community can come up with a bylaw. I saw one community in North Bank that they have some series of bylaws. If you enter into the community like Njawara, I will give you an example. You will not enter into Njawara without stopping and wash your hands before you get into the village. And if you are going out of the village also to another village, you also will have to stop and wash your hands. So these are the communities are coming up with community bylaws. And we want to appeal to the general public, or communities themselves now, to come up with strategies and policies to be able to address, because government alone cannot do it. You don't have policemen or the security men all over. You don't have public health officers all over. So it is people who are all over. It is the people now who should help us to be able to address the challenges that we have ahead. Without their involvement, we're going to have some challenges. That one I want to emphasize very well. This is where health promotion comes in. That's where people now to take up their own responsibilities of health, and we have empowered them with the knowledge and skills. We have given them information. We have provided with materials. We have guidelines and regulations. They have to use those guidelines and regulations to protect themselves and their families. That is where everything should start. That
is true. Would you agree the reason why we are having a surge in this rate is because the lack of enforcement? I have seen something like this in the US, in states where governors have put strict measures, even when the federal government said, let's open up, they refuse to open up. They are not having increase in numbers. But in states where they have opened up their economy too soon and they have loosened up their measures, we have seen a surge in those states. Is it because of the lack of enforcement? That's why we are having both, whether it's a sign of on the side of the citizens or on the side of the government in not enforcing to the mass, but is it because of the large lack of enforcement? Do you think that is why we're having a surge?
I will not agree with you to say it's only lack of enforcement. It has several parameters. One of them is, for example, could be the relapse in behaviors. Because, how do you bear with me? At the beginning of the pandemic, people were so serious with hand washing. Yes. Everybody was busy running after hand washing facilities. These are hand washing tanks. Everybody, every compound you enter, they will tell you wash your hand before you enter. But now there's a relapse. That's not happening. So people have dropped in the behaviors, the energy in the prevention and control of COVID-19 at the community level have also loosened a bit. So we will also—
Is it because of the communication strategy? Your communication strategy? Is it
the community communication strategy? You know what happened? We call it what we call resistance. People have gone to a level, we have been giving them so much information, and they are now resisting to our message. They want to see the application of the law. This is society. You implement your communication activities, someone will be there to resist. Like even whereas you use a strategy called the fear tactics. They will tell you, if you are a fear tactic, if you have corona, you will die. They will tell you, and so what, everybody will die of a cause. This is where the resistance starts. So this is, at this point, we don't want to use fear tactics. We're also using very simple strategies, and they try to coach them, try to ensure that they adopt our behavior, the positive behaviors that we are promoting. But that has been a challenge. That's one aspect of it. The issue of the enforcement, it could be it's another challenge. I mean, right now, as I tell you, with regard to the face mask, it is going to be implemented to the latter. Either we will think of a strategy, how people can be fined. If they are fined, who collects the money, and then all those things we're going to discuss that tomorrow, maybe in our meeting, and we're going to come up with recommendations. But that has to be implemented. Evidence have shown that proper wearing of face masks at all times, and as well as coupled with observance of social distancing, you reduce the transmission rate to 0%. So therefore, we are not compromising with regards to the wearing of face masks, and we are also not compromising with people who are also conducting programs or gatherings that will attract many people to be there. People's interaction can also facilitate the spread of the virus. So therefore, this is one of the areas that I would want to say. Many people are aware, but they don't believe in it. There's also another barrier to us. The beliefs that the disease doesn't exist is another barrier. So this is why we need to break. No matter what communication intervention we use, certain people in society will ever deny. They will ever deny. And we have certain behaviors that the persistent questioners in society, these are people who will be asking every now and then, what is this disease all about? What is it all about? So I want to see the end. At some point, even among some journalists, many people don't believe in the disease. But what we did, we were able to arrange them to go to the treatment center. They saw things for themselves, and they came back and said, on the whole, this disease is real. That's where we were able to break the barriers among certain people, especially the elite, the educated people. Those are some of the journalists. So since then, we have the support of the journalists, and we also want the communities. Not every committee member can see somebody with a COVID-19 positive case. So it is going to be difficult. But we want to tell them it's real and let them also abide by our advice and the regulations that are already currently in place. We need to put on face masks. We are not saying face masks like this, you put it on the cheeks. No. We are saying masks covering the mouth and the nose. That's what we are promoting. We also want people to observe physical distancing, all social gatherings, football matches. Going to the bars and restaurants, dancing clubs, and then naming ceremonies and other things are all banned under the regulation. So people need to know that they are banned. If they operate, video clubs are all part of it. If we operate a video club, that will attract a lot of people. And we know that video clubs, no matter what you do, people will still be there. These are calling for people, so they are all banned for now for the next 90 days.
So are we looking forward to seeing any lockdown? Because a lot of Gambians are proposing maybe to lock the country down for a week just to stabilize the situation. Are we looking out for, are we expecting anything like that from the ministry?
It may happen, it may come, lockdown.
Now that the president have entrusted the minister with all these responsibilities, are we going to see any of those?
It may be, it may not, but I'm sure these are all things that internal discuss. It will also call for internal discussion, and we are discussing it, and we will come back to the general public as and when we agree as to what should happen.
So I want to talk about the health officials. I know that a lot of them have been tested, and they have been tested positive. And so what strategies are you putting in place to protect these health officials? Because if all of them test positive, who's going to take care of us when we're sick? This is alarming. And then the reason why this is also happening, Mr. Njai, is because when I'm sick, the only place I think about is the hospital. And this person going to the hospital doesn't know whether she or she is already, carrying the virus. And they come in contact with these doctors and they transfer the virus to them right away. So what measures are we putting in place? Especially, I have seen, I watched somebody's video yesterday, a health official in America, and she was recommending that instead of letting patients come in directly to the health facility, why don't we have tents in front of all health facilities? When people come, they can just have instant body, I don't know, how do you call it, instant test, so that we determine whether they carry the virus or not. If not, we let them go into the facility like that. They come in contact with people along the way. And this is how most of our health officials are getting infected. And if this rate continues, at the end of the day, we will not have anybody taking care of us. And that becomes very serious.
Yeah, we're thinking of all those strategies you think of, like especially the rapid diagnostic testing.
Yeah.
This is also one of the things we are thinking of.
Yeah.
Discussions are around that one. We also now, I know capacity strengthening is key. Building the capacity of our health workers, and also to ensure that they are provided with an uninterrupted supply of PPEs. So that any time PPEs are needed, enough facilities are available. And these PPEs also, when they are available, they also be trained as to how to put on the PPEs and how to remove it.
Can you adjust your camera? Can you adjust your camera?
Oh.
Okay, yes, good.
I said PPEs, they will be trained on how to put on the PPEs and how to remove the PPEs. Because I know this is another critical area. Like if you are to remove PPEs, you might cause infection to yourself once you remove the PPE. Perhaps you may have dealt with somebody who is positive, and then you may have, then you start removing the PPEs, then you start to do what we call the cross infection.
Okay.
So we're also going to consider that, building the capacities of our healthcare workers, and also to ensure that facilities are provided with isolation facilities, and then equipment. As you know, recently, a lot of supplies came into the country. The government bought a lot of materials, and the ambulances are part of that, and other materials that are needed for, especially PPEs, that are needed for health facilities, and that are also currently being distributed. We're also thinking of now decentralizing screening and testing of COVID. So this also ongoing is high on the agenda. And then basically the whole thing is about capacity strengthening at all levels. Yeah.
So let's finally, before we go to my final question, so I know that we had 10,000 test kits from China, and we did have some also in country before. During when you first when we started this conversation, you did say we have tested over 6,000 people, right? Did you say around 6,000 to 7,000 people?
6,011.
6,011 out of 2 million people. We have tested under 10,000. Is this the real reflection of COVID-19 cases? Out of 2 million people, why are we not testing? Is it because we don't have the kits, we don't have enough test kits, or why are we not testing massive testings? Why are we not testing?
You know, as I told you before, at the beginning, we didn't have the National Public Health Laboratory to be functional, and now the National Public Health Laboratory is functional, doing the testing, sample collection and testing. And then also we had challenges at the beginning, people were not coming forward to test. Yeah. And I'm sure people like you did not even test, and you don't want to be tested. So, and I tested anyway, and I tested negative.
I want to test.
And then people like you are many in the country, and they don't want to know their status.
When they have signs, I don't have any symptoms, so I don't feel like I should.
But you can voluntarily go and test.
So you know what I said?
That's the cooperation we are not getting from the public.
My colleague Nima tested because we were together every single day, and she came negative. And I said, just because you came negative, I believe I'm negative too, unless I have symptoms.
That is what is happening.
I don't have symptoms.
That is what is happening all over. Somebody, in fact, the people I tested and I was negative, and many people who interact with me, they will tell me, "Oh no, for me we are safe. Once you are negative," but that's not the case.
Yeah.
So we don't know what you have, where you have. For you don't go anywhere. But somebody can bring you with a mobile phone. Somebody can bring you a mobile phone, you touch it. Somebody can bring you a laptop. Somebody can bring you papers. You don't know. So it's important that so when people don't come out for testing, test kit is not an issue. That one is not an issue.
Do you have enough kits? Test kits?
We have enough test kits. The last consignment, up to close 1.2 million face masks, and so many. I cannot remember the test kits that are available there, but I'm sure if they are there, I will not know the number, but I can be able to come back to it and then give you the real figures. But test kits is not an issue.
It's worrying that out of 2 million people, we have only tested almost 7,000 people. That is really
only 6,000, yeah.
6,000 and like let's say 50.
And 11.
That is really worrying. That is really worrying.
Yeah, it is worrying.
I think we should encourage more governments to come out and test, but also the ministry should make it available. Because like I said earlier, I know people who want to be tested, they still cannot have access. And I have spoken to the highest level of people at the Ministry of Health, and I'm still not able to get this person tested. So that is also, I still take the blame to you.
I told you some of our gaps. And then for testing, we are trying to re-strategize.
Yeah.
We will come up with locations where testing should be done at regional level. So that, in fact, this can be tied to the hospitals. So that if every hospital, there will be a place where testing will be done. or sample collection can be done, and testing can be done. For example, if you are in the Upper River region, then MRC Basse will be responsible for, will be doing the testing and of the samples.
Yeah.
So likewise, Kedeba, and we are also thinking of all the hospitals like Bansang, Soma, Buyam, and others, Sew. These are all areas that Farafenya, we need to have, we are thinking of having, and as I speak to you now, the information I got, the test kits for the laboratory teams are already been sent to these regions and hospitals for testing the content. So you can see we are ready for it.
Okay. All right.
Yeah.
So finally, so we know that a lot of people have been tested at the State House. We know that the Vice President came out positive and some other ministers, and we want to pray that they come out of this sooner than later so they can go back to work and help with the work. She's the head of the COVID-19 response, and she's been doing an amazing job. So we just pray for her and all the ministers, the Minister of Finance and Agriculture and Petroleum. We pray that they have a quick recovery so that they can come back to work. But the concern is also, if this number of ministers have been tested, have the president been tested?
Now, can you repeat that question again?
Have the president of the republic been tested?
Well, I have no information about that yet. Or if there's any information, I will let you know.
So you are not, you don't know that whether the president is tested?
Even the ministers you are talking about, but I only speak on information that is on our seat rep.
Yes.
I rely on the seat rep. I'm sure the information that is coming, it has not come to me officially to say that this is what has happened. But the seat rep, I will get an information on that, and then more details. If I need more information, I go into it for the line listing. So when they do the line listing will tell me who are the ones that are infected. Then I'm able to know, and then I can say, yes, this is exactly what is happening. But as of now, as I did not receive the seat rep, I cannot validate what has been on social media. I only validate what is already on our seat rep. And that's what I talk about. And because that is the Minister of Health language. Thank you.
So finally, what is the update today? I know that, yes, 2 days ago we had 95. What's the update today? Do we have
the update today? I'm waiting for the seat rep. That's why today I'm still in the office. So when I get the seat rep, and then we'll come back and break the news again. But I'm sorry, it will not be a good one because we're going to have more and more new cases coming up. Yeah, because we are in the peak period.
Okay.
Thank you
so much, Mr. Njai. I want us to, this is something that I want to be doing every day, either whether it's you or Dr. Bite or other health officials. At least I want to be doing 4 times in a week to update people. This one, the first one was generally to talk about everything, but every day we will come in here and just advise people as to what to do. Sometimes I'll bring other private doctors so they can also advise people what to do and how to protect themselves. When help is not yet with you, what do you need to do? So this is something. So I want to thank you for being my first guest, but I also want to commit you to becoming more often so that we can have you at least twice in a week or 3 times, and Dr. Bite as well, so we can, because it's always important to hear from people like you, so people can be rest assured on what you are doing and how you are working to help all of us. What's your final message to Gambians?
Thank you. But I want to tell people who are here that the way they do mask, what I saw in the market today, people just bring the mask to their cheeks.
Yeah.
This is not the way to put on the mask because it's not covering your mouth and it's not covering your nose. Yeah. We want the mask to be like this. It will cover your nose. It will also cover your mouth. It's just there to protect you and somebody around you. So that when you are infected with the virus, when you are talking, the water that is coming out from your mouth will not go out and then get to someone else. That's the essence of the face mask. And that's what and we also want to remind people that wearing of face masks is mandatory in the Gambia. Everybody must comply. You must have to put it on, especially when you're in public. Yeah. And today, Father, if you mistakenly go out without a face mask, be rest assured you'll be arrested. Today, the street is full, and the securities are doing what is expected of them. So we mean business, and we are moving on from there. So we also want to advise people to continue washing hands with soap and water at all times. Because hand washing evidence have shown that it reduces the pneumonia by 30% and then diarrhea by 60%. So it's important that we continue washing our hands, even away from COVID, but we need to continue washing our hands. But with the presence of COVID, it should be mandatory that every time you, whatever you do, you wash your hands with soap and water, because you don't know, the hands have gone, they normally go everywhere and they go to many places. So it's important that we wash our hands with soap and water at regular time. We also want to advise people for them to do away from organizing festivals, marriage ceremonies, naming ceremonies, and then we also want to advise people, those who are operating clubs, nightclubs, video clubs, where you have casinos and so on, that all those operations are banned for now. Anyone organizing football matches and people organizing events at the beach sites, they are all banned for now. No beach activity, no football activity. All those we are doing are banned for now.
Yeah.
Thank you.
Thank you very much. Nawek just went, so thank God. But thank you so much.
Light is gone. Thank you.
Yeah, I think it's a general blackout. Mine also is gone. Thank God.
Thank you. Thank you.
Thank you very much, Mr. Njai. I do hope I'll catch up with you tomorrow or day after tomorrow. We'll arrange that to see. We want to come here every week to talk to people, to advise people. At this point, we should all take our personal responsibilities. At this point, what happens to me or my family, I should also take responsibility by making sure everyone washes their hands. I make sure that you don't let people come into your home just like that. By making sure you adhere to the WHO and Ministry of Health guidelines, because these are things that we, in as much as the ministry want us to do it, they will not be able to force us to do these things in our homes. They don't have the capacity. So I think for all of us who are home and those of you who are outside in the diaspora, I think most of you, we should do the calling. I do remember there was a time during the elections, people were calling their families saying, do this, do this, do this. So this is another time that we need to call our families back home. Call them, tell them about the disease, tell them what they need to do. If you are opportune, if you have some money, try to buy some vitamins for them, especially the older people. Get them prepared, prepare their immune systems. If the local things that are at home, the oranges, the apples, the bananas, let's get people to use these things to help prepare their immune system. I think that is very important, and I will definitely be here tomorrow. I don't know who my guest will be. I hope Dr. Bite is available, or Dr. Samate. I have tried to get your boss on several occasions. He's so busy.
You'll get him.
But
you'll get him. Don't worry, you'll get him.
Yes, he promised to come on the show. So we will try to do this daily thing and to have all the health officials, even private doctors. I'll try to have Dr. Baji. I've been working with him, on so many people that have symptoms. He's been very helpful. So we'll also try to have him on the show. But yes, thank you very much, Dr. Modou Njai, Director of Health Promotion, Ministry of Health. I want to appreciate your time. Thank you very much.
Thank you.
And make sure I get one of those masks, okay?
Okay. Yeah, no problem.
All right, Modou Njai, thank you so much.
Bye-bye.
And to all of you, thank you very much. I'll definitely see you tomorrow. Bye-bye. See you tomorrow. Bye. Bye, everyone.